If you were alive during World War II, then our first segment involves you and the baby boomers who followed. It is that time of year again for those 65 or older because Medicare Open Enrollment is about to begin. Don't let your plan auto-renew. It is crucial to select the right plan for your health needs, and you might need to be aware of some changes as well. After all, it is a government program. Many of you are putting this on the back burner because the process is so complicated, but we're about to make it much easier because the service is free and can be expanded in several languages, or explained in several languages. Emily Trevino and Kim Nguyen with Wise Insurance can help simplify the Medicare process and ultimately help you make the best health care decisions. Good morning, ladies.
Good morning.
Good morning. You chuckled there when I said, after all, it's a government program, yes. Right? Because things are changing constantly, which is one of the reasons why you are constantly learning about it.
Absolutely. So, Medicare is offered to anyone over the age of 65, and this is your health coverage. This is what's going to take you into your retirement years, and it can be overwhelming. And a lot of our Medicare beneficiaries, whether they're transitioning or they're currently in there, they tend to make mistakes by just assuming their plan is going to continue to operate the same way it always has. And to your point, the government's changing constantly, and so is healthcare. And so that's why we're here to make it simplified.
This is one of those things that's out of sight, out of mind. We've heard Medicare our entire lives, and the minute you think you're turning 65, all of a sudden it was like, and what is that Medicare thing again? Yeah. So you find a lot of people struggling basically to renew, but also people who are starting for the first time.
Yes, and a lot of people think that it's free too, as well.
Yeah, right. Yeah, it's like, hey, no free rides here. No. Okay. Wise Insurance, your whole office has a care team, and so you have plenty of people to call upon to help people with whatever stage they're in and trying to figure this out.
Absolutely, and the reason why that's important is there's a lot of agents out there that will just sell you a product that'll help you with your Medicare throughout the year, but
they'll get you in the program.
Exactly, they'll get you in the program, but the thing is you'll have, you'll get a bill that you didn't know that you were supposed to pay that, or you felt like you paid your copay and you got something else. And so there's a lot of questions that come up afterwards. And so having a care team has really helped us help our clients access healthcare all year round and for their healthcare plan to work the way it's supposed to work.
Yeah, another thing you all can do that is so important in a city like Houston, because we're the most diverse city in the country, is that you all can speak to people in various languages. Because again, hard enough to explain, but then when you have to translate it.
Absolutely. So we have Vietnamese, Spanish, and even Chinese as well. We do have some Korean agents that can help. So I think it's important to be able to speak in this complicated Medicare world in a language that you feel most comfortable in, and usually your first language, even though you may speak English as well, your first language is where you feel the most at home, and this is a very personal and intimate process that you're going to go through with Medicare.
Yeah, all right, I'm going to back up to what you hear all the time. What do you mean open enrollment? Oh, I did that already, right? Okay, so open enrollment, what does that period entail?
So we actually starts on October 15th. So as of tomorrow, every Medicare beneficiary will have received their plan changes, and I encourage them to read them and understand what's going to change in 2026.
Pause, that's where the problem comes in.
Yep.
I encourage them to read them, right? That's where a problem comes in, okay.
So then after that, they can shop from October 1st through December 7th, but you really want to look at the changes. Make sure your doctor takes a plan, your prescriptions are covered, and not be surprised what your out-of-pocket costs are in 2026. Yeah. So make sure you do that before December 7th.
And make sure your doctor is even still working, because I heard somebody I knew the other day, she literally goes, I would start to go to the doctor, she goes, they retired and didn't let us know.
Oh, no, that's terrible.
Yeah,
well, we work with a lot of primary care doctors around Houston to really help them educate their patients because they're busy practicing healthcare, and so sometimes we give them a good reminder to do that.
Yeah, and you said something there too. You said make sure they're still taking the plan, because they can come in and out of plans too, right?
All year round too. It's so unfortunately a lot of people may not know their doctor takes a network, and so one of the things that we do is we do thorough research to make sure they're still taking the plan and they intend to do so in 2026.
All right, there's some common mistakes that people make. One is assuming your doctor still takes the plan, which you just explained. You can't assume that, and so that's part of the reason why you want to sit down with people and look at everything with a fine-tooth comb.
Yes.
All right, and assuming your medical costs stay the same, your deductible or copay.
Your copays, co-insurance.
All right, and then assuming your prescription costs stay the same. Now, we all know that just in the world before Medicare, like the prescription costs can change drastically as well.
It can, and so there's also the drugs can come in and out of the drug list. So your plan may not cover it at the cost that you thought, or maybe not cover it at all. So again, we have to do our research on that. And so a lot of the clients, we want them to make sure they understand what doctors they can go to, what their costs are going to be, whether it's deductibles, copays, co-insurance, and just make sure the plan works the way they think it should.
Yeah, Yeah, and a lot of people are also confused. If you're coming off of a plan that you may have had working in a corporation, you had a different health insurance plan, and then you quit, and then you retire, and then you go into Medicare, there's a medication that may not cross over, or services, or your doctors, right?
That's right. And so that's where we come in and we have to help you find a solution. And there is a solution for pretty much everybody out there. We've never not been able to help somebody.
Yeah, there's also a lot of questions. I had somebody stop me in the hallway the other day, and he goes, okay, well, open enrollment runs through December...
October 15th through December 7th.
Okay. He goes, well, I turned 65 in the spring, so do I have to wait all the way until open enrollment? Yeah.
He has his own open enrollment window. So when you do turn 65, you have 3 months before, month of, and 3 months after. I encourage you to do it before you turn 65, just so you don't have any break in coverage, or you could face penalties too.
Yeah. All right. When someone comes to you, take us through the process. They sit down, and what are some of the first things you ask?
We ask what their current situation is, if they're going to be retiring, not retiring, or maybe they're already on a plan. We ask what are their major medical concerns that they're really worried about. Sometimes it's cancer, heart attack. And we want to know what their doctor's situation, if they want to access a certain health system, maybe Memorial Hermann, Methodist, something like that. And then we'll start asking about additional benefits. Do they need dental, vision? We were just talking about vision. So things.
And some of those things can be extra, right?
Some can be extra, and some can be built into the plan as well.
Like
so
your
just
cataract
really
removal,
depends.
that's usually covered.
That's
But
right.
if you want the cataract of lenses, that might not be covered, right?
Yeah, or if you wanted LASIK, that's not going to be covered. So it's our job to educate what is covered by Medicare and what's not, and then we make sure we have solutions for those that are not covered by Medicare.
All right, I can hear it right now. What do you have to say to the person who says, well, my granddaughter, she's really good with this tech stuff and all this type of, she'll help me. It's okay. Well, granddaughter's not really, unless she's educated in this, right?
Well, that's true. And I spent a lot of time talking with our legislators and educating them on how all this works. It is overwhelming, and I would love to have your granddaughter be part of the conversation just so we can help her. But it is it's overwhelming, and there's a lot of nuances, especially when it comes to doctors.
Yeah, and your service to help people get through this cost what?
Zero.
Free. We can't say free.
She just said it.
It costs you. It's not a cost to you. How about that?
Yeah, it's not a cost to you. It's zero.
Not a cost to you, and it gets done. What do you have to say to somebody who is putting it off right now? Because I know how we are. Human nature is to keep waiting, and then go, wait, what was the deadline again? So what do you have to say to somebody?
Well, it might be too late for you to change it, and then you're going to start using it beginning of the year, January the 1st, and like, oops, well, my doctor's not in there anymore. Oh, or my drugs is not covered. And then all of a sudden, like, you have co-pays now.
Yeah. Okay. So get on it right now. Don't put it off so you can sail through the holidays not worrying about something.
Correct.
Exactly.
All right. Ladies, thank you so much.
Thank you.
I guess I should say be wise.
Yes.
Right?
Be wise.
Yes. All right. So thousands of Texans trust Wise Insurance to protect their health and their wallet. Give yourself peace of mind this open enrollment season and give them a call at this number. It's 832-699-3334. Again, that's 832-699-3334 for a free Medicare review. You can also find more information online at wisehealthins.com. wisehealthins.com. Be wise and make your appointment today.